The government made it a legal requirement last November for anyone entering a care home in England to have 2 doses of the COVID-19 vaccine. Friends and family of care home residents were exempt, but care home workers were told to get the jab or lose their job. The government may have scrapped the vaccine mandates, but it's uncertain whether people will want to go back to the jobs they lost.
Now those care homes are still trying to recoup the staff that they've lost. They could re-employ some of those staff, but the reality is if you've already been sacked from your job, you're unlikely to want to go back to work for them.
It really has heavily affected a sector that has been working so hard and tirelessly over the past couple of years. And then for the legislation to come in place, meaning that many care workers have had to choose to leave their position, has had a real significant impact on the sector itself. Not only have we lost really great care workers, they may have gone out and found other positions in other sectors now. The question is, will they return? And we suspect some will. But many won't, and that's a really difficult thing for the care sector.
Officials estimate around 40,000 care staff lost their jobs. The majority of care workers are women. Employment lawyer James Sage says some were likely to find the changes in guidance around vaccines for pregnant women confusing.
Originally, the guidance was that if you were pregnant or thinking of starting a family, the government guidance was you shouldn't be vaccinated. And then the guidance fairly quickly changed to, oh no, we think you should get vaccinated. And obviously, for those people who are making big life decisions, that's quite difficult to suddenly be told, oh, now we think there's not going to be any exemption for you. You need to be vaccinated. And I think a lot were concerned, and unfortunately, a lot of those concerns were difficult to overcome. What was quite odd then was that although the government position to the nation was that if you are pregnant, you should be vaccinated because there was a concern to your own health if you weren't. They did then ultimately provide a temporary exemption for staff who are pregnant. So the guidance was just going backwards and forwards. So it was very difficult for that group of employees. We're also now starting to see some employment tribunal claims come through the system for those staff that felt that they were unfairly dismissed because they didn't want to be vaccinated. Although, in the vast majority of cases, care providers should be able to be able to fairly defend those claims on the basis that they had a legal requirement to enforce mandatory vaccination.
Ministers have said both Brexit and COVID have added to staff shortages. Care bosses say they felt like residential care was used as a guinea pig for the vaccine mandate policy. The Royal College of Nursing represents almost 500,000 nursing staff in the UK. National Officer Claire Jacobs says despite the government U-turn, some organisations are keeping the vaccine mandate.
The RCN's position is very, very clear, is that mandatory vaccine is not the way forward. We believe all nursing staff should have the vaccine. It's their, certainly in terms of registered staff, it's their professional responsibility to have the vaccine. We believe that's right and proper for their protection, but also the clients they're looking after. However, it shouldn't be mandatory. That needs to be made as a personal choice by everybody. We're really concerned that some employers are still, and even before it became legislation, are still expecting that to be a mandatory term of employment. And whilst we understand that during the legislative period, employers were forced to have to do that, and many were unhappy about that, and we've worked very closely to support those employers. There are other employers that actually continue to make it a mandatory requirement. Which we think is not fair.
It's worth mentioning that the Health Secretary made a speech at the Care England conference, and in it he thanked care home leaders and care home staff. He said that COVID isn't over, but also said that the country is better defended against it, highlighting the vaccination programme, testing and also other treatments against COVID. He also said in response to a question that if there was an outbreak of COVID-19 in a care home, that it would be up to the care home manager's judgment on what measures to take. Now, he didn't accept an interview with us, and he didn't mention the government's U-turn on the vaccine mandates in his speech. And of course, those vaccine mandates left a lot of care workers in a difficult position. I mean, some care workers would have taken the vaccine even though they weren't quite sure about it. And now with the U-turn and the vaccine mandates, they'll be left thinking, oh, what did I do that for? And it's also left the care home providers in a difficult position as they try their best to follow the laws while retaining their staff. Jane Werrell, NTD News, London.